I guess we'll get ready to start here. So, hey, how's everyone? This is the Ben and Gary Show. We know dentistry, and we have a very special guest this episode. This is Dr. Angela Noguera. She is an endodontist, and she's been able to join us to be able to add a lot of flavor to this show. And the question that we kind of wanted to address this time was about, well, as a matter of fact, why don't I just let Dr. Kahara kind of tee this one up here, and kind of tell us about what we're going to talk about today.
Yeah. So again, first, Angela, thank you for coming and joining us today.
Welcome. I'm glad to be here.
Yeah, it's a special thing that we have you here. She's very busy, you know. She is a past president of the DC Dental Society, a past president of, you can tell me more, but she's been a past president of various dental associations and meetings.
The DC
clubs.
Dental Society.
Yeah. That was, yeah. So.
Well, we're all very active. We're all very active locally.
It's pretty impressive what you've done.
Absolutely.
So,
thank you.
Thanks for
your dedication to the practice, to your practice, to the profession, and what you've done to be able to promote the profession and keep it afloat so well. It's been amazing to me.
Well, thank you.
Yeah.
Thank you very much.
Yeah. But so we're going to talk about why it's important for our patients who see Dr. Noguera for root canals to then come back to the restorative dentist, which would be us, to have the teeth restored properly. So, Angela, why is that important? I mean, you spent a lot of time first treating the patient, going through the diagnostic phase to determine why the tooth needs a root canal, and then
your handoff is
and then
Yeah. So if you all remember, when we do root canals, it's really the standard of care to use a rubber dam. And the reason why we use a rubber dam is because we need to have a very dry area of working. And so, in essence, contamination is really a very important part of the process. And so we use the rubber dam to prevent the bacteria to go in. And after we've done all that work and spent perhaps one appointment or two with the patient, everything is closed, and it's imperative for the patient to go back to their restorative dentist so that they can get the tooth completely sealed. And this truly should be done in a reasonable period of time. I think somewhere between 2, 4, 6 weeks, the patient should really be back. And the only reason we wait that period of time is because after the root canal, the patient experiences some tenderness in the area and sensitivity, and so it's. I think you all appreciate not working on the tooth when the tooth is tender.
Yeah.
So that's primarily the reason, and that's why.
So how can bacteria get into the root canal system if left untreated?
Well, the bacteria comes from your saliva. We have over 600 species of bacteria that live in our mouth. And they are just normal there, but when you have either decay or you have an open margin, or the majority of the times is related to very old restorations that are falling apart. So there's a window, an entry point for the bacteria to get in there, and so then it starts affecting the pulp, and usually patients start having symptoms.
Right. But my question though is more after you've done the root canal. I mean, if they don't come back, then of course, there are various ways for bacteria to then reinfect what you've done, right?
Yes, and so after having a root canal and spending all the time and money, we really don't want the tooth to get reinfected.
Right.
And so it does happen because at the end, listen, it's like with all the dental materials, every time we drink hot, with cold things and chewing, there's tear, there's wear, there's expansion and contraction of all the materials. So through those movements, you could say, of the materials, then you get filtration, and you get like a contamination. You could potentially get that. I mean, there are some studies that actually say that in 30 days, if you haven't had the tooth restored, technically is reinfected. That's a very hard thing to believe, but I mean, all that is in the literature.
That's amazing. Well, the worst case scenario for me is I've had patients that have had root canals and they don't come back for probably a year or so, or maybe longer, but then there's a lot of decay in the access opening. And of course then you're really
Yeah.
behind the 8 ball.
That's really
It's like worst case
a
scenario for
worst
you.
case scenario, and I think that's the reason why more and more today you see endodontists just closing the access hole
Mhm.
permanently
Right.
with some kind of Luxacor material or
Yeah.
some hard material, because
Mhm.
once the patient is out of pain, it's very easy for them to,
No.
okay,
Right.
I'll do this tomorrow,
Yeah,
and then
exactly.
next thing you know, a
Yeah.
year passed.
It's not a priority any longer.
No.
Well,
Yeah.
everyone's busy, right? So
Yes,
yeah.
yes. So at least this way we can seal and double seal that access, and even if the patient, well, then we're at risk of fracture. That's another big thing.
Right.
If-
Yeah,
if
I wanted
it-
to say that, like, about especially the back teeth, you know,
Yeah.
after you get a root canal, they're waiting a year. They may come back where
Yeah.
they're in pain again, or they may come back where the tooth is broken in half because
Gotcha.
Right.
you know the tooth's weakened.
Yeah.
And you know all about that.
Yeah, and if there were pre-existing large restorations there, and plus the endodontic treatment,
Right.
and through the use, then
Mhm.
it's easy for that to happen for a fracture, and that's just
Yeah.
not desirable.
Right.
Now, what I've noticed when I send patients to you is that you have a very, very small access opening, very small preparation. And so tell me about the philosophy behind that.
I think that everybody's really moving in that direction, and it's all about dentin
Mhm.
preservation. We're trying to keep as much of the tooth structure, I
That's
think,
the bulk of the tooth.
of
there.
the bulk of the tooth,
Mhm.
because I think when rotaries came about, and
Yes.
everybody got very happy with the rotary instruments, and we got carried away, and perhaps a little too much
Mhm.
dentin was being removed, and
Mhm.
we were flaring the canals too much, and that sort of weakened the tooth at the pericervical area.
Oh, okay.
And that's where the torque happens when you eat and
Sure.
chew, and the
Yeah.
forces go.
Yeah,
So
the
that
bending
becomes
moment
the weakest
Mhm.
point.
Wow.
And so I think everybody's really moving in to be much more conservative.
Mhm. Yeah.
And that's why you hear, even today, the gentle wave is also based on minimally invasive,
You have to create a seal around
yes,
that in order
and,
to.
and with minimal removal of dentin, because I think the concept is valid not only in dentistry but also in medicine. You hear all the procedures
being
being
conservative.
done
Yeah,
of
yeah,
minimally
sure.
invasive. I think
Exactly.
it's a general concept that things heal faster. So
Well, from a restorative standpoint, I'm thinking about just, the patient now comes back to us, and we've
Right.
had to probably, if it's most teeth that have had root canals, we have to put a crown on top of it.
yeah,
And certainly the concern is that tooth would potentially fracture if you don't.
Right.
But with that point of like making the smaller access openings, I feel like that's going to not only prevent it from being so weak, but it's just like the dreaded vertical fracture or catastrophic fracture of a tooth after that's been done
Right.
is sort of like not what we want to have happen because it dooms it.
Yeah.
So I think that being more conservative about that
Yes.
is going to be a way to be able to prevent it and obviously save the tooth for long.
well, and I think you can see in your practice that a lot of endodontically treated teeth are lost over a short period of time. Let's say
Yeah.
5-6 years later after a root canal, and that's sort of not the goal.
Disappointing, yeah.
It's very disappointing. Nobody wants that. We would like to see 10, 15, 20 years.
Right.
And we're hopeful that by doing this conservative approach and preserving more dentin, that we can, prolong that
Yeah.
period of time, because it just seems, don't you think that that's a common finding?
Oh yeah, absolutely, yeah. I have another question that comes up often is that patients, say for instance, have already had a crown, and now it's time. Unfortunately, the nerve is giving them a problem. They say, hey, listen, I have to have a root canal because the nerve is going through a slow death
Yeah.
process, and the root canal was designed to take you out of pain. You have to make a hole in the top of the crown, and then you send them back to us, and then depending on how long the crown has been there, you may suggest to have the crown replaced. And sometimes patients don't quite understand why.
Yeah.
How would you address that?
Well, it all depends on the integrity of the crown, and of course, it's sort of a team decision between, not just from our point of view, but obviously you being the restorative dentist, I think, have the ultimate word on it. But sometimes the integrity of the structure itself is just not there anymore after we have to drill a hole
Right.
again over it. And so it becomes necessary to do that. And perhaps that's why sometimes if we think that there's going to be a need for a root canal, And I'm not saying doing a root canal prophylactically, but sometimes it's not black and white. It's just
Right.
gray, and we are so close to having to make a decision that sometimes it's probably better to do it rather than putting the crown and then the patient becomes symptomatic.
Sure. Yeah.
And
Especially
then
if
no
it's
one
an
is happy.
ill-fitting crown. You know, it's wonderful you can seal the very top of that tooth, but then if the crown is not necessarily fitting so well, the number one reason
Yeah.
why you end up with a recontamination from a root canal is from leakage.
Right.
And
Yeah.
so that's leakage from around
Correct.
the perimeter of that
Yeah.
crown, and it seems like that would be another reason why. End up having that discussion with them, and I always feel like it's really great that you know, as a team members are just extremely valuable because you have an opportunity to be able to see the tooth in a way in which we don't get a chance to see it from the inside out,
Yeah.
and you have microscopes that allow you to be able to see you at a much higher magnification to see internal cracks and maybe other imperfections that have occurred over time that help us to be able to make a nice decision.
Yeah. No, that's very true.
Yeah, and it's really important. So, well, I really appreciate really being able to kind of add some clarity to some of these reasons why we need to be able to tell our patients to be able to come back to us after they're out of pain, that you've taken them out of pain, that the job is not quite fully done yet, and we have to make sure restoratively that this tooth is going to be around for a very, very long time. And that's a team effort in the process to do that. And with her expertise, we've been able to make a lot of people very comfortable and make the right decision to be able to hopefully save that tooth for years and years to come. And I really appreciate you being on the show.
Thank you.
Thank
My
you.
pleasure. I love
Yeah.
having. Very, very happy to be here.
Awesome. Well, we'll see you again on the Ben and Gary Show. We Know Dentistry. Bye-bye.
Bye.